may be quite audacious to state that we are in a new renaissance period in the field of irritable bowel syndrome, but I believe it is fair to say that this new period started for our laboratory at the time when we received funding from the AGA Research Foundation. We felt we needed to develop new non-invasive methods that would allow us to evaluate the functions of the stomach, the intestine, and the colon. So as part of the AGA Research Foundation's award, we had developed and validated the non-invasive transit measurement, which allows us to assess how fast or slow content moves through the colon. By doing this, we are able to assess whether a medication is actually going to be efficacious when it's tested in larger clinical trials. And up to now, we have a 100% success rate in predicting whether such a medication would be efficacious or not.
I'm participating in this trial because it's difficult living with IBS, and I think it's important to try and find an answer not only for myself, but others who are also struggling with IBS.
We are working to try to identify the individual factor that may be responsible for the patient's symptoms, and this will allow us to personalize treatment for every single patient. And for us to reach this goal of personalized care, more research funding is going to be necessary. In order to start to develop these non-invasive tests, it was essential to have seed grants. Yes, my institution was providing some support as a young faculty member in the gastroenterology division at the Mayo Clinic, but it was also very important to have the support which I was very fortunate to receive from the AGA Research Foundation.
Dr. Camilleri's research and his trial is important to me because I think it will offer me hope for the future and better quality of life for myself as well.
Having been personally a recipient of the awards from the AGA Research Foundation, I believe it is now my responsibility also to give back to the Research Foundation. Advancements in gastroenterology, the renaissance in different aspects of gastroenterology is going to require research funding. I think this is one of the ways in which I will impact not only the careers of young colleagues, but ultimately patient care. I give back because I look forward to young investigators continuing this renaissance in gastroenterology.
Support the AGA Research Foundation today.
I'm a basic scientist who works in digestive diseases, and DDW is a meeting that's really valuable for me because I see both the current up-to-date science as well as have an opportunity to interact with other collaborators and colleagues in the field. DDW is really the place where cutting-edge science is presented, but also it's a unique opportunity to interact with investigators from around the world. It's also a really great opportunity for trainees to interact with senior investigators and potentially develop new collaborations and future job prospects. At DDW, we're going to have an emphasis on the basic science of the gut microbiome and inflammation and cancer, and we're going to have a special sort of focus on Saturday and Sunday where we have a theme. Saturday we're going to have microbiome as our theme, and we're going to have invited speakers and a special session all day long, which is going to allow interaction between scientists who are interested in gut microbiome. On Sunday, we're going to have a similar program which includes inflammation and cancer, and similarly will be located in one specific area and allow people with that interest to interact over the entire day.
When I found out that I had received the AGA Research Scholar Award, I felt like I had won the Nobel Prize. I was so excited, and I felt so incredibly inspired that I knew that I had research that I thought was really exciting and could help people, but now I had the support and the validation of this amazing GI Foundation behind me.
The AGA Research Foundation is more important than it has ever been in supporting the careers of young investigators for two reasons. One is the federal government is no longer a reliable partner to provide the funds for research that we've relied on up till now. And second, because the timing is so important. We are at the threshold of key research advances that will cure digestive diseases. We have the manpower, we've trained the people. We need to have the security that they can stay in research and advance those cures.
Research is so important in many ways. It is one of the ways that it allows us to find out what new things are happening. It may in fact result in change in therapies. So there are so many ways that doing clinical research can actually change the way we practice medicine nowadays.
Without the AGA support, we would not be able to produce new therapeutics and detect new biomarkers for patients today suffering from esophageal cancer.
I study functional gastrointestinal disorders, which are really common. The patients do not have good treatments to benefit their symptoms. They also have a poor quality of life. A lot of providers invest a lot of time in the patients, but the patients also need us to invest research dollars to understanding this disease, finding better treatments for them, and improving their quality of life. And the AGA can do that.
We need the support of everybody, the clinicians, the researchers in the GI community, and the support of the AGA Foundation to keep our research cutting edge to help the patients of tomorrow.
It's been a passion of mine for many years to be a physician scientist, and what the AGA Research Scholar Award enabled me to do was discover new connections between the nervous system in the gut and the immune system, which will allow us to provide novel targets for treatment for patients with inflammatory bowel disease.
I honestly hope that people laugh at us 100 years from now. I hope they go, wow, can you believe they used to take out somebody's esophagus for Barrett's? Can you believe they used to ablate Barrett's? And just like chuckle. I mean, we're not going to get there without research dollars.
So I give back because I look forward to the AGA Research Foundation helping others in the same way that they've helped me achieve professional success.
I give back because I look forward to seeing innovation in the field of functional GI disorders.
I give back because I look forward to new and exciting information that might actually change and improve the way I actually look after my patients.
It's a really exciting time in GI because in the anti-reflux space and in the bariatric space, there are a number of devices just coming to market and in the pipeline. This year's Tech Summit will be quite exciting, and coming out of that, we hope to really have a great plan set up for innovation for the upcoming year. The advent of personalized medicine and its impact in oncology is clear, but I think we have some surprises upcoming as far as how we can really apply that and leverage that within gastroenterology. The beauty of that meeting is we have investors there, we have major corporations who may buy or invest in these technologies, we have innovators who have the ideas, we have people representing startups, and then we have some people register who don't tell us who they are, but then a few years later we see what they have developed and we find out why they were there. Our ability to help influence the future instead of react to it is critical. And one of the key things that we look at are the people who attend to be participants. When they're at our meeting, we want people who are on the floor to be able to come up to the microphone, ask questions, and help us move the field forward.
Our goal with this publication is really to provide unique content that really speaks to all of the needs that young gastroenterologists have, and to put all that content in one place. In the winter issue of 2016, we had a great article on management of celiac disease by Sheila Crow and a couple of her colleagues at the University of California, San Diego. And we also had a very interesting article from a group at Mayo Clinic looking at really the top hits for research in 2015 in esophagology, IBD, and motility. Not only do we want to touch on the clinical issues, but obviously there's a lot more that goes along with being a young gastroenterologist. So looking at future careers, dealing with the financial considerations that we all have to deal with at this stage in our career. All of these are things that we don't hear much about either in fellowship or in our young careers via other avenues, so we think this is a perfect vehicle to deliver that type of content. So we're hoping to incorporate some articles about funding. In every issue we do advertise the upcoming awards for young investigators and young career gastroenterologists that the AGA offers, and we're in the works to collaborate on a few pieces with the NIH for future issues as well. We have our next couple issues set, and we have a lot of exciting content. We have some interesting feature articles, one on the management of Barrett's esophagus, another one on non-alcoholic fatty liver disease. We have some interesting post-fellowship pathways, looking specifically at a career in private practice. We have some interesting financial articles, especially on the whole process of home buying. And we also have some other kind of special features as well. We have Dr. Peek, editor of Gastroenterology, who will be providing some tips on how to write effective abstracts for meeting submissions. If anybody has an article that they'd be interested in running by us, they're certainly welcome to email myself or Ryan Farrell, the editorial assistant at the AGA. And also if there's any ideas or things that we could potentially address or we haven't included in our previous issues that would be of interest, we'd certainly love to hear about that as well. The New Gastroenterologist can be found at the AGA website. It can also be found at the GI and Hepatology News website if you prefer to read it online. We also have a free app that's available via iTunes, Google, and also on Amazon. And the app provides all the content, provides it, of course, free, and it's very nice if you want to read it on the go. And it also comes in print to all AGA members. It'll come bound with GI and Hepatology News on a quarterly basis.